calling the Cook County Human Services Board to order. So, now I have to remember what to do.
We're rolling start here.
Welcome to Minnesota, Jan.
I need to walk. So do I hear a
Motion to
A
approve
motion to
consent
approve.
agenda.
Yeah, a motion to approve the agenda.
I make that motion, Madam Chair.
I'll second. Thank you. Madam Chair, I just wanted to interject that due to my husband's medical appointment in Duluth, I have to leave at 10. So when we get to the committees, if you want us, if we get there, to do our thing first or not.
Okay,
your
I'll
call.
put you first on the
Your
committee.
call.
Yeah,
Okay.
no, that's great. Fantastic.
I
So-
second the motion.
Yeah, very good. Any other comments? All in favor?
Aye.
Thank you. And the consent agenda. Do I hear a motion to approve the consent agenda?
So moved.
Thank you. Is there a
Second.
Thank you. Any discussion? All those in favor?
Aye.
Thank you. Okay. So we'll move on to our Cook County In-Home Support Program report with Olivia. Olivia is presenting to us today for her first time, so we'll be.
Go easy on me.
We'll be kind. Welcome.
Well, good morning, as Sherry said. My name is Olivia McGee, and I'm one of the newer additions up in Public Health and Human Services. I just passed probation, so I've been here 6 months.
Yay.
It's exciting. It's exciting. I think it is. And one of my primary roles here at the county is to run the in-home support program. So I'm here today just to give you a brief overview and let you know how things are going. So we'll get started. And I like colors, so everything has lots of color. Be prepared.
That's good.
So what I do for the in-home support program is I am the designated coordinator and manager. So I run and manage and do all the policy and paperwork, all the fun behind-the-scenes things that we all like to do so much. So as you know, we're licensed by the state and we're governed by statute 245D, which is a pretty cumbersome statute that I've read through quite a few times and I've gone to trainings on, just to ensure that we're not only compliant with the standards, but also making sure that people are protected and covered by that standard as well. I also train, support, and oversee our providers, so that's from the minute they fill in their application, I work with them to make sure that they're feeling competent and feeling like they're able to do the work that they're set up to do. I also initiate and match service recipients and providers, and that sounds small, but it takes weeks to do because you're filling out paperwork and you're trying to match people and match characters so that everyone does get along and people are being served in the most appropriate manner. I also do quite a bit of paperwork. I'm sure that we all do a lot of paperwork. But for every new service recipient we get, I have at least 15 to 20 pages of information I have to roll through with them and get signatures, and we have to update that annually. So that's a huge role that I play, is making sure everything is in compliance with our license and in compliance with the statute. Also, billing review. There's a lot of ways to bill for this program, which is both good and it's kind of cumbersome. It's time consuming. And so I make sure that the billing, and I work with YAPA as well to make sure that everything goes smoothly for people so payment can be received by the service providers. And troubleshooting, not everyone is made to get along, so we do have times when the service recipients and providers have their hey or say and they don't like each other or they need a new provider, so I do a lot of the mediating between everyone in that respect. What is homemaking? Homemaking can be a lot of different things to a lot of different people, and each program you'll see it be a little different. Sorry, it's a little hard to read, but I'll go through it. So for in-home support, we consider homemaking to be cleaning and organization, so that can be heavy housekeeping, painting, small yard work and house jobs. It can also be meal preparation. A lot of service recipients like this because they don't want to cook anymore. They always look at me and go, Olivia, I've cooked for 50 years, I'm done. I'm like, okay, cool. So we'll get somebody else to do it for you. That's great. Transportation is a huge piece of what we do as well. And that's not only transportation for errands, it's to help people keep their social agendas, because we want people in the community who can't drive to be able to still be connected and still do the things they like to do. We also, through in-home support, provide transportation for medical appointments. For those on medical assistance who do not have transportation, we provide that service as well. And we also help provide more along the lines of emergency transportation for other clients through adult mental health, case management, and children's services as well. Companionship and personal support. that can be a lot of different things to a lot of different people. Some service recipients, as you know, a lot of people in the county live here on their own. They don't have family members here to look out for them and check on them. So for a lot of service recipients, their provider is their person. It's the person that comes in and checks on them, makes sure they're okay. And it's really rewarding for some of them to know, okay, I've got somebody who's gonna come check on me once a week and make sure that I've got the food I need and make sure that everything's okay. So that's a huge piece for many, many people, that social connection and social interaction. As well as respite care. Respite care is that for people who do have caregivers that need a break, caregivers should have a break. It allows us to provide that respite for those caregivers. Who qualifies for in-home support? Any Cook County resident with a permanent or temporary disability, and that could be a serious or persistent mental illness, a certified disability through Social Security, or someone who has rehabilitative needs. So if you get a major surgery and a doctor goes, you shouldn't be doing housework, we're gonna write an order for it. That allows us to provide that service for those people as well. And anyone over the age of 65 in the county also qualifies for that program. And we have a sliding fee scale for those who are over 65 as well, so they can get some cost share assistance with that. Where are we in Cook County? I'm proud to say that we are canvassed throughout the county. We're not just in Grand Marais, we're also in Grand Portage, we're in Hopeland, we're in Lutsen, we're in Tofty, and we're in Schroeder. A big win for me is that since I've started 6 months ago, we've initiated 16 new service recipients into the program, which is about a 70% increase from where we were. We've also added 4 new providers throughout the county. So we've got people on the west end and in the east end that we've added in, which is really excellent. I'm proud to say we're not just in Grand Marais, but we're everywhere.
Great.
Our program goals, so our goal for every service recipient really falls in line with what DHS has as a goal for people, which is to keep them safe and independent in their homes, because the goal is to keep people in their home as long as we can, and if we can provide a helping hand to do that, we will. And also to keep people connected and supported. The beauty of this being run by the county is that many, many people also get to ask about other services. I get calls all the time about, what is SNAP? What is medical assistance? And I'm like, oh my gosh. We get to help other people who maybe felt there was stigma behind having county services until we're able to really sit with them and explain, here's what this is and here's what this can do for you. And here's how easy it is to get. It's not that hard. People often think the paperwork is a bear, but it's really not as bad as they think it is. So I'm able to help be a mediator between that too, which has been really great. And overall, our goal is to grow. The more we serve in this county, the less people there are that are underserved. So our goal is to take this small program and to continue to grow it, to continue to add more service providers, because that's job opportunities for people in this county. And that's also a way to help others and make sure everyone is covered and everyone is served. That's that. Do you have any questions? I'll open it up to you.
Great report. Questions for Olivia? I'm sure there are some. That was very enthusiastic.
Thank
Well
you.
done.
I like what I do. It's fun.
Yeah, I can tell.
Madam Chair?
Yes.
Olivia, that's really great. So you have about 40 workers that go out into the
We
county?
have 14.
14, okay. And like how long would they spend with a person? Once a week, twice
It
a week?
depends on the person. We have some service recipients who have multiple providers, so they have multiple people coming a week. Others, it's every other week. For some, it's just once a month. They want somebody to come in and deep clean the house once a month. So the beauty is it can be anything to anyone, and you can make of it what you want to make of it. So it's flexible in that sense.
And how about the cooking part? Are groceries brought to them?
Yes, if that's what you desire. So if it was you and you didn't want to go to the grocery store, you wanted to have nothing to do with it, you could put it all on your provider and say, you pick it up, you make me meals, make some, freeze them. And they do that for a lot of people who don't like Meals on Wheels, and it's okay to not like Meals on Wheels. It's not for everyone. And so it allows service recipients who don't want Meals on Wheels to have somebody come in and make large homemade meals and pre-package them out so that they have other things to eat during the week.
Does Meal on Wheels, does that go all over the county, or does it at?
From my understanding, it does. I know in Grand Portage they have their own Meals on Wheels system. Meals on Wheels here, I don't know if it goes all the way down through the west end, but I know you can pick them up and get frozen ones as well.
Okay.
So we do some delivery. I have had to arrange for that.
Thank you.
Great. Other questions? Commissioner Gamble?
Thank you, Madam Chair. Thank you, Olivia. Your temperament and personality is certainly an important ingredient in being able to facilitate, and because there's such a diverse number of individuals and needs, and where they're coming from, being able to read people and match people up is a big part of making a program successful. And for those that serve in this area, understanding that and pairing them is again a big part of the success of the program. So I think it's significant to note it in the context. Sometimes we comply with the requirement, we do a job without that component that is so important in human relationships. So appreciate very much the ability and the gift that you have to be able to do that.
Thank you.
Other questions? Commissioner?
Yeah, thank you, Madam Chair. Thank you for the presentation, Lydia. Just a comment and a question that you may or may not be able to answer. It just seems so helpful for people to be able to stay in their homes,
Right.
to have all the services that they need, that otherwise, if they didn't, they would have to go someplace else, perhaps out of the county. And it also, I've also heard, and I don't know the numbers exactly, but we actually save money by doing it this way.
Yes, we do.
And maybe you can tell us a little bit more specifically, you know, how the county saves money by actually providing these services for people in their own homes.
We're saving money, I guess the easiest way I know how to put it is, we're saving money by not having everybody institutionalized. The cost of institutional care is very high, and it's a huge cost for the county if people are on medical assistance and things. So that's usually the primary look at it. And we also look at the hospitalization. When you don't have people around looking out for you, your odds of going to the emergency room, which of course is a high cost no matter what, your odds of the emergency room visits are a lot higher. So we have a lot of service providers who catch people who are sick right away and say, whoa, let's go to the clinic before we have to go to the ER. And they're able to troubleshoot with clients who are not feeling quite well or not feeling like they're quite themselves. So there's the two most obvious ways would be the institutional care and the emergency room visits.
And I bet you if you asked every one of them, they'd rather stay in their homes.
Oh my goodness, you have to think about the quality of life in all of this too. Would you want to stay? I wouldn't want to stay in a care center. I worked in one. I don't want to go to a nursing home, and so I always think if it's me, what would I want? And what would I want in this situation?
Yeah, not to disparage the people that do that work. I mean, that's very difficult work, and they
It
do
is
their
very
best to
hard.
make people's lives their best they can. However, given
However,
the
it's an
choice.
institution, it's not your home.
Yeah.
You don't get to go into the kitchen and, do whatever and diddle around all day. It's an institution in and of itself.
Great, thank you.
Yeah.
Thank you. I have a question for you, Olivia. So just to understand the structure a little bit, you work for the county, and then these 14 workers who you supervise, coordinate, are they volunteers?
They're independent contractors, so
Okay.
they aren't technically county employees, but they do some of them receive payment through the county because some service recipients do have the elderly waiver or on the sliding fee scale, and that funding is billed and funded through us then.
Great. Thank you.
Yep.
Can
Any
I-
other? Oh, yes.
And then the billing that we pay those providers, and then we bill and get reimbursed for the
Right.
Through the
providers.
medical insurance.
Right.
Sorry, I should have clarified that.
Oh, no, that's great. So it's, you're coordinating all of this economic activity, and we're billing and paying and.
I'm learning.
Yeah. Yeah, it's complicated. Great, thank you.
Thank you.
Thank you.
Any other questions for Olivia? Great report.
Thanks,
And,
Olivia.
yeah, so we will move on to the financial report. Yaffa's magic.
I basically want us to spend our time and energy on 6 and 7 today.
Okay.
Got a bunch of numbers there.
Page 6 and 7?
No, items 6 and 7 on the agenda.
Got it. Oh, got it.
Staffing.
Thank you. Okay, so you're forfeiting your.
Forfeiting my time. We can spend it on 6 and 7.
Okay.
Thanks, Yaffa.
Which is very generous of you. But are there any questions on the financial report that you want to ask Yaffa before we head on down the agenda? Yes.
Thank you for always doing a very wonderful job with financial reports.
You're welcome.
Okay,
Thank you, Yapa.
so we will, well, before we go to 6, we'll have the director lead into 6, but director at number 5.
Thank you. Nice being back now that I've actually had some time behind the job to be a little bit more familiar. So starting with our public health update, the first thing I just want to say is the Family Connects program that Allison and Joni brought to the table, they just got back last Friday, late evening, technically Saturday morning, and they just finished the training in North Carolina for Family Connects. So hopefully at the next meeting we'll be able to have them kind of report on our plan moving forward with that now that they've had the training. The other big one, and I just passed them out during our advisory committee, Louise from the Community Health Board came out and presented the Bridge to Health survey results. We were going to talk about them here, but she's offered to come out next month and present them to you, and so we'll kind of go over those there. But I wanted to give you guys a copy so that you could look through a couple of the things I noticed right off the bat for you guys that are number people and want to look, where there were a couple in the 18 to 24-year-old age group with like tobacco and alcohol. Just kind of looking through those, there were a couple spikes that were slightly worrisome when you go through there. Just look at some of those main health concerns that kind of caught my eye. The other big one kind of goes with public health and human services, is working kind of with RENA. And the last 2 employers I've kind of run the help with the Facebook page. I've kind of seen what RENA's done with hers, and we've kind of talked with our supervisors, and we're working on a plan to submit to RENA for our own human services and public health Facebook page. I think it's important to have that separate than the counties, just because the type of information we want and the comfort level that we want with the people that we work with. I feel that they have that better relationship if it's Cook County Public Health and Human Services rather than Cook County, because of the type of questions and the stigmas that they would face. So we're going to try it out and see how that works. It's something we're just going to kind of put between some of us. I'll help manage a lot of it depending on how out of hand it gets, but I think it's a good way to get a lot of the information out there. And as someone that's now learned a lot about your Grand Marais sell and swap page, this is definitely a place where Facebook works very well. And so I feel like it'd be silly not to take advantage of everything we can to get our services out there better. Moving on to the human services update. So the first thing to talk about a little, I don't have numbers here, so I don't know if Allison does. So there was a discussion 2 weeks ago about the homelessness situation that we're kind of foreshadowing this coming fall. We talked about it a little on the advisory committee. So we have a lot of people that are either and I'm still kind of acclimating to this, but they're in housing that won't work in the wintertime, and that's coming up, or they're in the process where they've had an eviction notice or something. But I thought we had, Allison, do you remember, was it?
Over a dozen.
That's, I know,
families and
yeah.
individuals that were facing homelessness.
So at the next advisory committee, Carla and us, we agreed we're going to put it on the agenda and kind of spend some more time really looking at the families and looking at what we can do. But I wanted to bring it to you guys as well, just because obviously that kind of hits human services very hard. And so, we don't know exactly what that means for us personnel and budget-wise, but it's something that we're looking at and we're going to try to discuss and kind of tackle, before it happens and do the best we can.
Commissioner Campbell, would you have a question?
Yeah, thank you, Madam Chair. Josh, relative to homelessness, is the greater percentage of that due to a change in housing, or is it something else? Because there's been some discussion in the past with development and that affects some of our housing that is used for some of the demographics of these individuals. And at the point we would make changes in that regard, then we're looking at trying to relocate. So I guess my question is if the homeless issue is precipitated by a change in our housing arrangement, or if it's just individuals that find themselves homeless.
Mm-hmm. Well, actually, since she just walked in, I'm going to ask Martina, because we had the housing dialogue yesterday. I'm just curious, what you feel like are the things that we have on the horizon for the housing. Are they things that will help with what you're experiencing with the problem that we're facing coming up with homelessness? Like, Do you feel like the project in Lutsen and Grand Marais, what we have going on, will help fix the problem? Or like you said, is it more of a like seasonal workers or people, is it more of a?
No, for us, it feels like these are people who live and work in Cook County year-round. And yes, the project in Lutsen especially is very exciting. It will have 16 units, and it's not going to be based on income, but it's going to be rent that is low enough that one person or two people, so you could have roommates living in the same room, could likely afford it. So it is very exciting. I thought someone brought up a really interesting point about how if you create more housing, like more apartments, you might have people moving up into those apartments from other units in town, and then those other units will be open to individuals who might need the Section 8. So I think it's a really good thing. I think it's going to be helpful for our people who are currently struggling.
And if I could follow up, thank you, Martina. When we've been looking at housing options in the community, there has been a long-standing housing provision in the community that was exploring options to develop some new housing, which would take away housing for existing people. And so that meant that we were looking, well, where would we take these displaced persons? So my question was relative to, is displacement what is causing the homelessness, or is it homelessness as we think of when people that are, financially distraught and can't afford regular housing?
I would say it's not the displacement, it's homelessness as we typically define it.
And I think there's a lot of variables that cause disruption in a family finance, and severe illness, where one or both of the family providers can't work for a while, or a child with an illness where one of the parents has to be home with that child, so it can only be a one income earning family. That's a variable for a lot of people. And also some of the housing is just in disrepair. It's too small to accommodate the families, or it's unsafe and they're looking for a new spot.
Or it's not winterized.
Okay.
And there's
Correct.
a huge amount of homes in the summer that you cannot live in. I mean, even at Gunflint Lodge with Oliver Housing, we have one full unit of 8 that we have to close in the winter.
So those financial upheavals, even though there's a lot of jobs in the community, I think health has a lot to do with people's ability to work and maintain their income, and so that's an important variable. What are some of the other things? I mean, I think just even housing conditions, several septics have failed, and they don't have potable water in their rental units, and so people can't live there. There's just a variety of reasons for people who are living in poverty and who have disabilities, or a family member has a disability that is affected by the low quality and low volume of housing.
Yeah, I appreciate it, Madam Chair. Just a final comment on that issue is that if homelessness is a result of what we typically see, things that you suggested, that circumstances in a person's life, as opposed to something that is done within a community that displaces people, then it's a different response, and it's in that we understand it differently because of actions and choices we've made. And so that's why I was bringing it up, just wanting to know the nature of what is precipitating.
I just wanted to add, that my memory from the meeting was that ballpark figure was 12 adults and 13 kids as a possibility, and that there was a problem with, I don't know whether you call it Section 8 or subsidized housing, that there was taking too long when there were vacancies and not getting response back from the owners of them in Duluth to get people in. And another thought people had from more, maybe not quite as low income, but that with all the construction workers here for the hospital and care center, that maybe some places have been taken up. But I know we were alarmed because we hadn't heard of these kind of numbers before. And winter's coming.
Yeah. Thank you.
Thank you.
So I guess, the ultimate being it's something that we're going to put on the,
Right.
dedicate some time to it in the next advisory committee, and obviously something our staff's been talking about as well, but we wanted you to be informed. Next thing, this happened last week, so I didn't have time to put it in the agenda, but I spoke to Jan about putting in my director's report, is that we did terminate one of a social worker 1 intake last week, it was during the probationary period, and just wasn't a good fit for, what we're trying to do as a department. So I'd like to go ahead and request to have that reposted so that we can move forward with that intake. Grace's staff will already working on a plan to kind of rotate the intake in the meantime, but obviously that's something that we want to keep that time at a minimum. So I don't know if you need to go ahead and put that to a vote, but.
Sure, Josh, so should we add that to the items for action?
Sure.
Yep.
Okay.
Then the next thing on here would be the legislative updates. So I've now finally had the chance to attend 2 of the MAXA meetings. The biggest thing that's happening right now with MAXA, if you guys turn to there, everyone should have the legislative position paper that I handed out. So the Governor's Child Protection Task Force met, and I should say that the biggest thing that came out of that was this legislative position or recommendation that they made that MAXA is trying to push as a legislative position. What that would be is that they want to change it to the state fully funds that no more than 10 child protection case management case workers per worker. Newly hired child protection workers would carry a 3/4 load until, I believe this class doesn't actually exist yet, but until the Child Protection Training Academy is formed and they would have passed that. And then establish a supervisor working ratio of 1:8. I've had experience with this, as I've told my staff, because we just went through this in Arizona, unfortunately. But and I kind of brought Grace here to talk about this further. But so right now I know we're at Cooper has 15 cases. I think we're about 15 cases per worker. So if this goes to the legislative session and passes this year, it's just something I guess I wanted to bring to the table and make sure everyone knows that. So this is where we would be at, even with Grace being a supervisor, since she's a working supervisor. So she's a kind of a half-time worker, half-time supervisor. So her supervisor work ratio would be 1:4, and she already has 5 workers. So it's just something for us to think about. And I know Grace kind of wanted to talk a little bit about also with our American Indian population that kind of our numbers work a little differently as well. So if you wanted to.
Yes, thanks, Josh. The one thing that I was talking to Josh about too, a couple of years ago, I went to a training with Lynn and another worker, and it was all about the Indian Child Welfare Act and again the effects of historical trauma and that effect on the work that we do with American Indian communities. And there was a suggestion there that the amount of time that you should have a lower caseload when you're working with families who have been so traumatized by the system. And I think it's just something to note. It's not the human services systems have really been destructive to Native American communities, and so for us to have positive interventions, we need to take time. We need to build trust with people who are fearful of the system, who have had a bad experience with the system. And so I just want to note that if we're looking at ratios, a family that has had severe distrust and has been severely traumatized by the system just takes more time. Also, the laws add more complexity, and so we need to make sure that we follow everything properly and we do everything correctly, and it just takes more time. So I just wanted to make that note, that in addition to the recommendations by the legislature, there's an opinion that more time and care should be spent on families who have experienced the historical trauma, such as the Native American families we work with.
Thank you, Madam Chair. Was there dialogue to understand the reasoning, or is it pretty straightforward as far as establishing the ratios? I mean, I can understand in the medical profession, given, the greater degree of need, that intensity means you have to take more time with an individual. Quotas get to be a little bit scary unless they're really well reasoned, and I'm thinking of St. Louis County, and there's going to be a lot of counties and county commissioners going, whoops, quotas, and our intent in our department certainly isn't that we don't serve people well and devote the adequate time to it, but the one size fits all and a quota basis gets to be very challenging, and as we know from the financial standpoint, when we look at public health human services, that has been a huge issue with us dealing with the mandates when there has been that funding component. So you're bringing it to our attention, saying it's on the radar. We need to understand it in the context of our primary focus is serving people well, but the quota thing starts to create some cumbersome components.
Well, that's what how would you use the term? It seems Max is putting all their eggs in one basket with this one. Like, this was the big one that they were pushing. So I haven't been here long enough to really know the climate of what that power is, of what that'll mean. But to know that this is where they decided really they're making their push this year. So I don't know if that's a strong push but I would agree with you. And we'll kind of get into that. I'll go into the next section and we can talk a little more, because the next part for the Region 3 update is we had a person from the state come out, and so I gave you guys each the child safety and permanency report. So as far as I know, this is the main report that we get from the Department of Human Services, and this is their kind of metrics for us. So we don't have to spend a lot of time on this, but it kind of goes over what you were just talking about. So if you go to page 2, the first one, % of children with a maltreatment determination who do not experience a repeat maltreatment. So you notice we had 0. So it's one of those things where metrics don't always work for rural areas, because obviously we're kind of skewing their numbers there. If you go to the next page, another one of these metrics, % of children discharged from out-of-home placement to reunification who were reunified in less than 12 months. So the target there is 67%, because we're trying to make sure that, it's best for the children to be with their families. We came in at 60%, so that we're under. Fortunately for us, because it was less than 20 cases, there's no statistical significance, so we don't have to do a performance improvement plan. But sitting there at the meeting yesterday and hearing them talk about these things, I was thinking the same thing as you. It's so difficult to make us say that these are the numbers, because the difference between the size of counties are so different that how do they hold us accountable to these things? But I still want to show the report. So as we go through the next one, % of children in family foster care that were placed in a relative home. On this one, we're actually doing a very well job, best in our region. So great job to my team at 71%. And then the last one, the annualized self-report index for Minnesota Family Investment Program. And I think all the counties except for one that was barely off fell within the range. The ranges were between 70 and 80% for all the different counties. Now, the reason I bring this up is because we met with the Department of Human Services. They came out and did a presentation, and they are trying to add 3 to 4 more metrics for mental health, and another 2 to 3 metrics for racial health disparities. And so, yeah, you're shaking your head because I was too, thinking to myself, I'm a rural county, and we have, all our American Indian population in our population that some of the other counties don't have. And so the good thing is us as a region, we didn't just sit there and take it. We let them know that their metrics have to be very specific, have to work for all the counties here. But for you guys to know also as we go to these things, I know you had the Association of Minnesota Counties meeting and these kind of things to know that they're trying to push these on us, and being somebody that comes from the epidemiology world of public health, I really look for statistical significance, and that our population can really be measured in these. And my fear is being there is that it's going to be more measures that are going to be pushed on us that don't necessarily correlate to us. And then, as you guys know, the performance improvement plans are an extra burden that we don't really have the time to do. And then just to make you feel better, I let them know yesterday during the meeting that I would much rather take, if they could give me one of those full-time staff of 35 that are creating these measures and help my staff out with a person, I wouldn't need the performance measures because, you know, I would be able to meet them with that extra staff, but it wasn't agreed upon. So. Any questions?
Did you have a question?
Yeah, thank you, Madam Chair. Yeah, it's important having discussions like this, that the public is aware that our intention has certainly been demonstrated by our staff, and we've had discussions on this that has been very wrenching relative to the human component of meeting human need and the staff that do that. So there's by no means an intention to try to avoid structure and accountability. It's just not encumbering people who have a heart and a desire to serve public need with process and things that become so I don't know, almost inhuman in extent. And I think that's where the discussion needs to be open and respectful, so that we aren't regimented into a system that compromises what we set out to do.
Mm-hmm. Well, you know, we were talking about the big one that was discussed amongst everybody was the out-of-home placements and reunification with the family in 1 year, and you know, all of the directors, and rightfully so, said, you know, if you know, they had to make the choice between letting their number go and doing the right thing, we're all going to choose to do the right thing humanistically each time, and it's where the numbers just don't necessarily work, but you know, we make our pushback, and probably just like Sue did, I'll make my pushback for us, and hopefully we can get somewhere with that. So,
Thank you.
Thank you, Madam Chair. Thank you, Josh, for this. I really appreciate it. You know, it just echoes back to the similar issue we had with the state when they were requiring 24-hour response time. And when we went down to the Capitol and I brought that to the attention of members of the committee who made that decision, saying, well, listen, we have so few staff actually able to work on this. And 2 different members looked at me and said, well, you're just going to have to figure it out. And yeah, and I thought, well, you know, and I don't know what you do with that. I mean, it's you know, largely the people who are making these decisions represent counties with workforces dramatically larger than ours, and so providing them some flexibility. But in this case, I mean, we're talking about, you know, a number of additional staff people that would be required, and as Commissioner Gamble said, they're not talking about resources, they're just talking about an additional metric or an additional mandate, and it would be great if we could accomplish that. You know, it really, I mean, this is what everybody has heard and knows that, you know, these are some of the most vulnerable staff people we have too, because of the stress and time commitments that they have. So how do we support them really without just, you know, having a state mandate that says that you have to? And I'm not asking for a response, but I'm just, you know, venting the frustration that I think many of us share.
well, I think that kind of takes me, unless anyone else has anything else, to my final comments, and I kind of spoke with Jan about this morning, was, so knowing that, by the way, I really like the job so far, so you don't have to worry about me going anywhere, but knowing that I like it, and my wife's now the art teacher at the school here, I don't know if you guys knew that or not, so she's teaching over at 166.
Great.
And so knowing that we're going to be here for a while and looking at the long-term things, I get into this, I suppose, perpendix that we always get into of the whole prevention versus tertiary. And it's not a conversation we have to have completely today, but the biggest thing in my mind right now as I look forward, and I had the opportunity to really, we did it when I first started, but Yafa and I stayed here till like 6 o'clock last Friday, line by lining the budget, which I appreciate her doing with me. And really looking through it and looking through like the trends over the last 5 years, especially with, you know, out-of-home placements and stuff, and meeting with these other directors and hearing about, you know, like $8 million out-of-home placements in some other counties that aren't that large, is And yet also, dealing with budget levies and not wanting to increase is working with you guys to where do we draw the line on, we have some of these programs like the Family Connects is starting, which is a prevention, what I would say a prevention program. And honestly, really Olivia with her program is a prevention program where hopefully we're catching people beforehand. And Grace and I were talking about, gosh, it'd be so great to see a number out there that I'm sure you guys would love to see too of how many people did we prevent going to out-of-home placement this year? Like, if I hired 3 more public health social workers, would I prevent, and they cost $180,000, would we prevent 300,000 in out-of-home placements? You don't see those numbers, but I realize, and I'll probably try to come to you guys with a good plan at some point, and as I continue to learn more. But there's that. We definitely want to work with you guys to find the balance on how much should we put towards the prevention versus, I'm big on that. Obviously, coming from the public health world, we've learned so much about, a sidewalk around the town can decrease, health expenses by 1% of the population. And I think the same thing with these out-of-home placements. It's like, where do I find the balance of, I don't want to just keep asking you guys for 100, 150, 200, the way these out-of-home placement costs are growing every year, because it just seems redundant to keep coming to you guys with those. And I also I don't want to ask for a bunch of positions when, my staff and I are willing to kind of take on some of that extra burden and work harder and do the things we need to do. But, that doesn't change the fact I don't want to just keep putting a Band-Aid on it. So hopefully over the next couple of months, we'll be able to, I can continue to work with Grace and Martina, and we'll figure out what we can do to help. But I'm sure I'm going to bring something to you guys, just knowing that, and for each one of you to think, or if you have comments now towards, where do we see that balance? Because I know you all know the importance of prevention, but unfortunately prevention does cost more money. I don't want to ask for another 1% increase the levy, which would be a worker, but I also don't want to ask for $200,000 more in out-of-home placement next year. So.
Good conversation.
Okay, sure. Yeah, an important component of that, I'm sure you realize, is and we talk about it like in corrections as well as in human service and in other areas, having measurable results. And so any request that works on the front end that is preventative in nature, when we can look at what reduces costs and improves people's lives, and we're able to measure that and support that through our experience, it's a lot easier, at least for me as a commissioner, to be able to support something that has that kind of basis for recommendation. So new programs that get it set up, we say this is what we do, so we know we're going to make it measurable. And it's one of the many times we hear it in different meetings we're in and things on programs that we begin and things is how are we going to measure this so that we know that we're being effective in what we're doing. We're either saving dollars or making improvements in an area. So as I appreciate the jumping in and willing to explore those options and those things and different ways of tackling the challenge we have before us, but certainly how we measure that and know we're being successful is an important component.
No, thanks.
So,
Wonderful. Then I'll pass it off to number 6.
okay. Go to 6. Allison McIntyre. Staffing updates. No, this is yeah. Oh, sorry. Yeah.
Good morning. I know some of this will be a review for many of you since I've come before this board before with some of this information. I do have some updates to share as well. This graph here shows our medical assistance caseload within Cook County. Let's see if I can figure out a laser pointer here. This might be a weird angle. So as you know, our caseloads have doubled since 2012. We have 393 cases currently in the METS system. Again, METS is the Minnesota Eligibility Technology System. That is the statewide software program for Minnesota's healthcare exchange, which includes both the private programs and the public programs as well. Our current caseload in MAPSIS is 197 cases. Maxis is the legacy system. That's that green screen DOS-based program that's been around for about 30 years. Beginning this year, we are going through a systematic process of migrating enrollees from the Maxis system to METS. As you can see, over the last few years since METS was introduced, those cases have migrated naturally as people's income increases. They may be ineligible in the Maxis system, reapply in METS, and have, for example, children who would still qualify for medical assistance because of those income limits, and then the parents would have tax credits. So that's happened naturally over the last few years, beginning, and I'll say a little bit more about this later, but beginning in August, we're starting the process statewide of migrating those cases.
Last month.
Yes. This is just another way of looking at those numbers in terms of people. So we have 1,011 people as of August 2016 who have medical assistance eligibility, are enrolled in medical assistance, I should clarify. There may be more people who are eligible but aren't enrolled.
20%?
20%. So what's the issue? As you know, I've presented this information before, but the METS system is not designed for caseload management. Many procedures that were simple in the legacy system are lengthy and cumbersome to process in the METS system. Often there are workarounds that are required to generate a correct eligibility determination. For example, the instructions for updating an address in METS. This is a fairly common change to make. The population served by medical assistance often move around because of issues with housing. That procedure for updating an address is 4 pages long, and that's just the procedure, not including sub-procedures and steps within that.
To change an address?
Yes. So something that would have taken minutes in the legacy system can take an hour, and additional follow-up to ensure that change interfaces. Just 11 to 12% of medical assistance cases auto-renew each year. Medical assistance requires an annual renewal of eligibility. When the system was introduced, we were told that 90% of cases would automatically renew. We found that it's the converse, that 90% require worker intervention. There's no reinstate function for a renewal that's received late or processed late by the agency. If a renewal is received just a day late, we must close that case and re-enter it as a new application. Workers must manually track all cases for interface from the eligibility system to the billing system. This is a huge pain point for our staff who, after processing a change, will have to continually monitor that case to ensure that the eligibility is communicated from the eligibility system to the billing system. So if there's a problem along the way, that individual, that family won't be able to fill a prescription, won't be able to be seen. We're finding that many providers are now verifying eligibility before they will see someone because of the issues with the METS system. Increased medical assistance eligibility impacts the income maintenance and the fiscal department in areas just beyond the case management. We're seeing a huge increase in the number of people who qualify for cost-effective insurance. So someone who maybe is offered insurance through an employer, but they still qualify for medical assistance as a supplement. That requires the financial worker to do a determination if that insurance is cost-effective, and if so, that person would be required to enroll in that insurance. So that impacts both the financial worker and the accounting who is processing payment of those premiums and requesting reimbursement from the state. Medical transportation requests have increased as the eligibility has increased. Medical assistance enrollees are eligible for reimbursement for travel expenses, required travel expenses out of county. So that involves often booking a hotel room if someone has an appointment early in the morning in Duluth or in the Twin Cities, and then processing those requests for reimbursement, billing the state. So that's increased activities for both our financial and fiscal staff. What's new since I was here last is migration and periodic data match. So the MAXIS migration, as I mentioned, is a statewide project to refer all MAGI eligible medical assistance enrollees. That would be all enrollees who are not eligible under a disabled or elderly basis from the legacy system to METS. Again, that's mandated, and the process began in August and will continue through September of 2017. Another major project is the periodic data match. So that is an additional annual eligibility check for medical assistance and Minnesota Care enrollees in the MET system. It requires additional worker intervention. Other counties have estimated that this will be a 33% workload increase for counties. Counties have received some funding to hire additional staff for this project. Cook County received a small allocation based on our caseload size. The total amount for 2016 and 2017 was just $2,169. So again, many counties are hiring additional staff to prepare for this project. It was initially set to begin in the fall. The IRS provided some guidance about the processes, and now it's been delayed likely until 2017. So what is on the horizon for 2016 and 2017? As I mentioned, the migration of those cases, the periodic data match. We also have annual health plan selection, which is the process for public program enrollees to select a new health plan. So that we see a big increase in the volume of calls and questions to the agency during that time, as people often have questions about the difference between the health plan selection, the open enrollment, and that annual renewal. Those are all separate processes. The open enrollment is the process for selecting a private plan in the exchange. As I mentioned, many cases are what's considered mixed households. They have mixed eligibility between the private and the public programs. So we do see an increase at that time as well. Some people assume that they need to reapply even if they're enrolled in a public program. So just providing that education to the enrollees about what's required and at what point during the year. The annual renewal, as I said, that's required for all medical assistance enrollees and Minnesota Care enrollees to renew their eligibility once a year. I looked at the reports for December and January. We will have potentially 145 renewals to process in Cook County, assuming that rate of 11 to 12% automatic renewal continues. And again, this is the healthcare programs only. This doesn't account for the cash and food programs that we also administer. So I'm going to just hand it off to Yafa to explain a little bit more about what's going on in her department related to the increase in caseloads.
Just a quick
Yeah.
question.
Questions before we move on?
Yeah, so could you remind us what's the point of going to this MAXIS system? I mean, other than to increase your workload dramatically?
Moving from
It-
Maxis to
the-
METS.
Yeah, MAXIS to METS.
Yes.
The
Excuse
goal
me.
was to modernize the system. We're currently using a very old system to automate processes. So to decrease the number of staff interventions to determine eligibility, the MET system was designed to be fully automated, but we have not found that to be the case.
Is there state awareness and some communication that they're working on the problem? I mean, or is this is the new normal?
Yes, I believe that everyone's well aware that the system is not what it was purported to be. I attend a regional meeting monthly with other Region 3 supervisors. Staff from the Department of Human Services has been attending to listen to our concerns. Many other counties are bringing staff who are living this day to day and can explain the challenges that we're facing. So there are many work groups and meetings, but the reality is that it's not changing fast, and it's impacting our staff and the people we serve.
So their response was to send us $2,000.
Specific to the periodic debt.
Madam Chair,
Yes,
Commissioners, I would,
yes. Thank you, Jeff.
the AMC Policy Committee on Human Services was basically about this problem last week. And the task force of human service providers who have gotten together to help the state to identify the scope of this problem and identify the issues gave some background, but their estimates are that this measure is costing counties $27 million a year in additional staff to handle this situation. And AMC, one of AMC's policy platforms for this year in human services is that resources be made available to finish the development of this project. One of the biggest problems was that there was a deadline for the implementation of this project, and the deadline was enforced even though the project wasn't ready. So that's in the hands of politicians. That's not in the hands of our staff here or even the development staff. Decisions were made based on deadlines and budgets without anticipating the cost that was going to transfer to the counties. So there's a lot of awareness, there's a lot of work being done on it. One of the policy asks this year is specifically going to be, let's set aside some funding to get this done. Unfortunately, the partisan politics in St. Paul are pushing and saying, we need accountability, we need measures, and so that is getting the attention, that is getting the development before they're addressing the usability of the system. So that's the practical problem. The user group that reviewed it, and again, these are human service workers in different counties that are in that group, said go back to Maxis, finish the development of METS, or throw METS out and find something else that works. And they said evaluating those options, the only option is to continue to work with METS because it solves problems that Maxis doesn't. And Maxis, much like the blue screens that we use in our auditor's office, it's just not a supportable format anymore. The AS400 format there aren't any programmers available to do that for us. So we need to transition to a new technology with the new staff. So they've reviewed the options, and that committee has said the only thing to do is go forward with this. Bear with us. Add staff as you need to, because you're still going to be held accountable to these standards, direction to the counties, and we got to work through this. But we are going to, as the MAXA and AMC, make this part of our policy platform that we need resources available to finish the development of this project. So that was pretty much the 3-hour presentation on Friday morning was this Maxis to METS conversion and a summary of what that's costing taxpayers at the local level.
Wow, Commissioner DeKirk.
The general committee also has 5 items at AMC to move forward, and we chose to support public health on this subject as one of our items. So,
I'm still confused, because last year we talked about our MNsure causing so many issues, having to add staff.
And
Is this part of the
No,
MNsure?
they are very, very separate. The
They're
MNsure,
separate? Oh,
the MNsure is a program.
Okay.
This is
Yeah.
just
This is just software.
This is just software
Data entry software.
that allow, yeah.
Okay. They're not connected.
They're not connected. They're not, you need to be able to make the entries into METS
Got it.
to be able to access the programs.
Got it.
But the programs are separate from the interface. Is that correct?
Right, yes, METS is the computer system that is designed to comply with the ACA requirements and is Minnesota's health exchange for the private market, but it's also the eligibility system for the public programs, and I think that's one of the problems.
And Yafa, you had yours.
And August of 2004, I was an employee of Colorado Department of Human Services on the implementation committee for similar project, but it was going to be all the programs, not just health insurance. And they ran out of money, and they had budget issues, they had political issues. They flipped the switch when they weren't ready because they'd spent their $200 million. When I was looking at it last year, I'm giving information to Sue, it was at $500 million, and most of it was sort of working okay 12 years later. So don't expect miracles in this state. And if you do find miracles in this state, tell Colorado how you got miracles quickly. So I think it's going to be a long-term issue. And actually in Colorado, public interest law firms sued the state because of the damage it was doing to the health and welfare of human services clients throughout the state. And that was one of the ways in which they got action.
Thank you.
It's a question I'd say, in listening to this, Josh, how's this compare with what you came from?
That I laughed because I got to meet Sue and the other regional directors the first time last month when they all came here for the regional meeting, and they all asked me what the biggest eye-opener was coming to Minnesota from Arizona and Texas, and I told them that honestly it's strange to me because now Arizona has a different setup with only 15 counties, so it's a little easier, but they really tell the state what to do. And because there's 15 of them, it's very easy for them to get together and be on the same page. And even in Texas, it was, even though we had a lot of counties, it was a lot more like that. And like when I saw the periodic data match thing, and we divided it by what our 780 cases and the amount of money they gave us, and what was it per case ballpark?
$2.70 a case.
For what's going to be $10 to $15 per case of work. And to me, that was just like, you know, we would have the ability to just say no. Like, you know, the 15 counties would get together. So I guess just getting used to that, kind of like what you were saying of some states you get the response of the counties can say no, and then the state has to figure out what they're going to do. And then, you know, to hear them say to you, well, deal with it, is just a different response that I'm not used to. Like I said, when the lady came from the state, you know, she's got this staff of like 20, 30 people working on creating performance measures for us. And again, I was just thinking to myself, how much easier that would be just to give that, you know, $2 million out to the counties and give us all more people, because as we all know, it's human services, they obviously want to do the right thing. Most of the inhibiting factor is you're not giving the counties enough money to do it. So why create all these standards with the money? I guess it's just hard for me. Like, how do you have a department that spends so much money creating standards for people that you're not funding to do them? So yeah, I mean, that's my answer would be, yeah, I'm not used to it, and I mean, I guess I kind of came here because I wanted to be on a more local level, but see that just like I did in Arizona, to get things done and complain and stuff, I'll probably want to be a bigger part of the people with a voice yelling again, because it's not right what they.
It's a good thing you're growing your hair out.
So you can pull it over your head.
Yeah, gotta have something to stretch.
Okay, so help is not coming, we have to live with it for a long time, right, Yapa? Is that what you say?
Yapa's gonna retire.
Where's the silver lining here?
Yeah. Silver lining.
Silver lining is when people turn 65 and get on Medicaid.
And really, people are accessing services that they weren't before. I think that's the silver lining. To echo what Josh said about prevention, because of the way that the system's set up, that everyone's applying, people who didn't realize they qualified for medical assistance are accessing free health care, they're going to their primary care provider and having preventative services.
That's good to hear.
And the application process can be very quick and easy. It's really that case management piece that's so challenging for counties. Having the MNsure navigators statewide who are able to help people through the application process is just invaluable. We work really closely with the navigators, now Rochelle at Sawtooth Mountain Clinic, formerly Rochelle, now Erin, Watson at Sawtooth Clinic, and being able to have that face-to-face in guiding someone through that process is so helpful, because we don't have that ability or the time to spend with people and guiding them through that application process.
Thanks. Any other questions for Allison before Bianca? Okay, yeah.
Thank you.
Yeah, thank you.
Allison was talking about two of the programs where once they work with clients and enroll them in cost-effective insurance plan, and then also medical transportation needs, then the accounting staff has to do work, which is Andrea and myself. We have 3 Allisons and Andrea, and a group of 8 people on the east wing, so.
The A's.
The A's. Yes, I'm the Y team. That's Y as in Yaffa, not WHY. So we then have to make payments, and then I do billing, and then some of the billing gets done by Julie Berglund, and then I do the review, and then if something gets denied, I do troubleshooting. And sometimes the denials were, we'll bill $3,000 and we'll get $2,997, and for $3 I'm not gonna go looking. If we're short several $100s, I'll go looking and figure it out and give Julie something to correct. Cost-effective insurance, we had to have the state intervene twice a couple of weeks ago with something that was not working as designed in the old green screening system. So I've been talking with my partners around the region, and all of them have 2 to 4 accounting technicians, and I have with Andrea 50% of the time billed to me, and Julie Berglund 25% of the time billed to me. I have 0.7 accounting technicians, and I'm saying bill to me if I don't have work for Julie, or if there's a big deadline in Allison's world. I don't necessarily have 17.5 hours a week of Andrea's time. And Lake County has 2 accounting technicians, Coochin County has 2, Aitkin has 2, Carlton, which has 7 times our population, has 4. So other counties that have 2 and 3 times our population have 2. So I remember being in June at a conference talking to the new fiscal supervisor, Coochin County, and asking her what she has to do, and then how many accounting technicians she has and what they do. And I'm doing about 2/3 of the work that her 2 accounting technicians are doing, and I'm not getting it all done. And it's sort of hard to come to work every day knowing you're not going to get all your work done, and you'll never get all your work done unless you work. When I was hired, I was told it was a 40-hour-a-week job. And the overtime that's being worked between my area and Allison's area, I'm skipping ahead. So, right now we're working an average of 12.4 hours a week extra between our 2 work areas, and 8 of those hours a week are between the 2 of us. So when we ask for additional staffing, some of that work's already being done now, and you're just paying time and a half, or you're paying more for the 2 of us than an accounting technician or an eligibility specialist would cost. Plus you're burning out 6 people. All of us are putting in overtime hours. And I have one of these printouts. I have got all the overtime hours and comp time hours that personnel on my staff have worked so far this year, and it was across the board. Everyone, even the new employee who started in July, has overtime that I assume some of it has to do with travel to training and the training time as well. But We have someone who moved from 40 to 35 hours a week, and she has yet to work 35 hours in a week unless she's taken paid leave that week. So we're putting in some of the time that we're asking for, and we just want additional staff to do that rather than having everyone working above and beyond every week of the year. And it's not every week of the year, but it averages out to that. So there is a week in July where, a pay period in July where I worked an extra 20 hours. Actually, I think it was only 19. And Allison's regularly working, bringing work home.
Commissioner Gamble, your question.
Thank you, Madam Chair. We talked a bit about this, and when a request comes before the board and justification for that request, appreciate the information. I know when I became a commissioner and I was looking in law enforcement and I saw $90,000 some dollars in overtime, and I thought, my goodness, we should be looking at, maybe an additional couple staff or a staff person as opposed to paying that overtime, which is at a higher rate. However, in that particular situation, those were grant monies specified for overtime, so we use it for overtime. But my point is that when you look at the financials and you see there's two components. There's one on paper, how much you're paying in overtime, and the other is, as you suggest, the human component of what you're tasked to do and how much work you have to do in every day. You feel like you're getting behind because it's stacking up. What you said, if I heard you right, you said you're working about, combined with staff, about 12 hours weekly overtime?
Yes.
And so we're paying time and a half, which means that's going to be about 18 hours or so that we have in there, and you're asking for a full-time individual at 40 hours. So right now, on paper, this is a correct statement, we can show that we're paying out of pocket half of that in overtime anyway, and then we have the component of burning people out. A question, we dealt with this in our assessor's office because of the workload moving into the position. So this is the question I would ask, similar to that question, is are there things that are new that we're dealing with that is contributing to this additional overtime that might even out in the long run, or is that not the case? So I'm looking at this decision in the context of what are we paying right now, what's it doing to our staff, the additional work that are we adequately staffed, and the third component is this work that we're doing because of something new that will level itself out moving forward so we wouldn't need the additional time?
I would say that there is some additional new work, and then there's also the question of how many hours I'm willing to work a week, and am I willing to do billing on evening and weekends? No, I'm not. I'm willing to work extra hours on weekdays, and I think there's been a historical pattern of working evenings and weekends to get caught up, and
we shouldn't, expect beyond, what we identify as the requirements for the position when it comes to that. I think we should set reasonable expectations as to what an individual in a particular position can accomplish within their work, period.
right.
And we evaluate that through performance appraisal and discussion on a daily basis as to how things are going. And if there's, something that comes in that's a blip on the radar that needs additional help in that regard, and that's why I referenced the assessor's office, because of the quintile processing. We had a lot of work on top of doing your daily. So it's just trying to understand our assessment of your request. I think that when we've talked about additional positions in public health and human services, in some respects, we've looked at it because we're not getting the timely billing of things in. So by putting a person in a position, we're actually generating money. And we're looking at that with our new land commissioner position too. Now we can be a little more proactive. It's a position that can help generate some money that'll help pay for itself.
Right.
In this situation, when we were talking, I think you alluded that that's not necessarily the nature of this, but that's another component of
Right.
understanding this.
A couple different points. One, we're understaffed, and we've been historically, I think, the last few years, understaffed. And we've been told to keep a line on the levy, and so we haven't been adequately staffed as workflow increases, and also the reality of how much work there is to do. And I think in some ways, it's like that frog in a pot of water. You'll work an extra hour every week, and then you work an extra 2, an extra 3. So far this year, we've worked between comp earned at straight time and time and a half. There's been an extra 1,000 hours worked in our department. So an extra half a person who we haven't hired, that we're all doing extra work. And it's, there's revenues that we're not getting because we don't have staffing. We've also made do with having people wear multiple hats. And so instead of having one person focused on a task and getting very good at it, you have people doing 2 and 3 different types of things. And if one's a higher priority than the other, it's a moment in time. And Allison's department, other things aren't getting done. We also have, I was at a conference in June, we were talking about staffing levels of different counties. Someone was talking from a larger county with more like a 85,000 population where they have one person full-time doing recoveries. They added a second person, and their revenues more than doubled by having 2 people focused on it. So that person more than paid for themselves, and the other person was able to get a lot more accomplished by having a support system. While here we have more of a reactive system with estate recovery. Wendy Danielson left in 2012 and was not replaced, and she was doing estate recovery. And so Sue and Jan were reacting when lawyers sent notices asking whether or not there was anything to recover. And Sue and I have been doing that, and now I've been doing that. So we're responding when someone asks, as opposed to having someone actively pursuing it. And that's been 4 years that we've been losing that revenue. And I asked in other counties in the region how much they were getting in some of those revenues, and it was all over the board. And I look at our 5-year history. 1 year we recovered $17 net. 1 year we recovered $40,000, $34,000 net. And that's since Wendy Danielson left. And this year I projected, I think, 14 or 17,000 net. So there's money we're leaving on the table with that. Medical assistance and other recoveries. I think your group, I'll let you talk for yourself in terms of recoveries. And then unbilled and denied claims where if I have a choice of spending 10 minutes to get $8,000 or half a day to get $800, I'm spending the 10 minutes to get the $8,000.
So before we move into, this is all really good information. Heidi, you're Commissioner DeKirk, then Jerry, then Josh, then Commissioner Moe. We've got quite a lineup here if you want to speak. So Commissioner DeKirk.
Can I just respond to the looking only at Yaffa's overtime? We have overtime across the entire department that we're gonna save on. And Josh already explained to us, do we spend 200,000 later when we could be in front of it and save the money on the front end? And Yaffa, you and I come from the same background, the same thinking, and I was just thinking one of my clients, I always had a stack and I tried to get through it, and they'd be like, Heidi, why are you still at 5 o'clock? And I'm like, well, I still have this stack. And they looked at me and said, trust me, no one else is gonna do your job, so it'll be there when you come back. Well, for you, that may not work because you have to get it to the state by a certain amount of time. So you can't just leave it on your desk and come back to it the next day or the next day. You know, some of my stuff I could leave for a couple of days and not do it, but I wouldn't be very mentally sound at night because I'd be worried about it, and I'm sure you do the same thing. So I would prefer if we looked at the whole picture and looked at the opportunities that we're gonna receive for doing this and look at the opportunities and continuing to keep our staff. It's really hard. I mean, we just had someone not make it through probation. And I don't think it's fair for us to measure the number of people we have in our county compared to other counties and how many staff they have, because the state has the same number of requirements on us as everywhere else. We have the same deadlines as everywhere else, and in some cases, even though our population is smaller, the number of people we help is bigger, the number of caseload per person is bigger. And so it's not fair to compare us to other counties and say, well, if they have 80,000 people and we have 5, then we should have 1 person to their, it's just, something's gotta give here.
Jerry?
I'd like to just make a comment to this issue of the toll that this takes on the staff. We heard essentially this presentation from Yafa and Allison at our advisory committee 2 weeks ago. And the response of the committee was very strong and very firm about wanting to support the staff in getting through this situation and getting the resources needed so that the stressfulness of it can be alleviated. And it seems to me that we're talking about the culture of the agency in some very real ways. If you've got people who, as we are hearing, I think today, are feeling a certain amount of hopelessness about, I'm never going to get my work done. It just continues to pile up. And I think in time that leads to a feeling of resentment. And I just don't think we want that to be our culture. That isn't what we're about. And we want to focus on what we can do to serve our clients and not be wrapped up in a negative culture. And so I think that was why our advisory committee had a strong response, and you'll hear a little bit more about a resolution that was passed to support this. But I just think that stands out so strongly, and it's hard to measure, and I think we have to think about that in addition to the specific financial numbers and the money saved and so on by having other additional staff. But it's a big point to consider the price we pay that way.
Josh, did you want to?
I'll kind of follow up a little on what Heidi said, because I was, one of the things why I want them to present, so they can kind of take ownership, and then I can kind of give you like what I've seen so far. And one of those really statewide, and kind of goes back to what we were discussing, is the economies of scale here. And one of the big differences I've seen from state to state is, so here in Minnesota, it's still very, they have this like direct correlation of, if you're this county, let's say you're the perfect person and it takes 40 hours to do this much work, and then there's this line that just matches, and you get down to the rural county, you can do it in 5. But as a lot of you guys know, it doesn't necessarily work like that. Like, there's a bottom of how much financial work there is, and no matter how rural the county is, you're still submitting all the same reports and everything. So, it doesn't just go all the way down to 0. You still have this, there's a baseline that you hit. And a lot of the places I've been, we do the we always do the base plus population before we divide and do all these merits where, we take a grant, we take funding, whatever it has to be, and we say, well, we know that with the meetings you go to and all these kind of things, that, there's a base amount of money that's required for any county to do any program. And then we look at population and everything and go from there. And it's one of the few things I haven't seen in the public health programs here, and that we face also with human services, is that you don't have that metric in this state. Everything's very population driven, and you assume that if there's 4 people in the population, then you barely don't have any work at all. But it doesn't work like that at the bottom. There's this foundation that has to be met first, and I guess that's where I see a lot of this coming into play for us and some of the other rural counties that I've spoken with. I suppose the other big one, what I saw right off the bat when I came, is Human Services and Sue and them, they did their best to kind of keep the personnel down. And when they did finally make the ask to bring some people on, they went with the easy thing, which was the people that have the direct interaction with the consumers, or with our clients. And but we didn't look at the back end support, and so she shows you that with a 40% case increase, and it's not really just your programs, but across the board in all the human services programs. And so we asked for those people that were like the pretty ones on the front lines that are doing the work, as we all know. For all these extra people you hire and for all the extra work, that's the back end office support and the financial people that get a lot of that extra work. And we didn't ask for that when we asked for new staff. And I really feel like this is just catching up, like she said, looking at the overtime, which I'm not someone that ever likes to see people have to do the comp time or overtime. And looking back at the trend, that's when it's really happened. Is we accounted and we brought on the extra people to do this, but we didn't keep that back end work kind of up to date with everybody. So.
Thank you, Madam Chair. Jess, question for you and or Jeff. We're beginning our our annual budget process. And I'm assuming by the conversation and the presentation here that there's a position and a half that is being asked to be approved that's outside of the levy, proposed levy increase. So this is, and so the urgency or, I would say that the urgency is such in your mind that you're asking to move this ahead of the budget process, and in front of the other requests that you have before the board.
This was part of your 2017 submission, correct?
Yes.
So it is part of the...
It's part of the 2017 submission, and we're asking to hire in item 7 in 2016, for the last few months of 2016.
Just a little earlier than
Yes.
2017 budget starting.
And if I may, Madam Chair, just to that budget issue, in looking at our 2016 budget, what we projected, I think, we're somewhere 300-some thousand over what we projected for 2016. So some of those things are things that, we understand how difficult it is to nail down some of these costs that are continually influenced by slight changes in clientele. So I guess to Commissioner Mo's motion, the fact that it's built into the 2017 projected budget that we received, it will affect that 300,000 figure over and above what was projected. That's all right. When you did your projection in your budget presentation, include that in that projection? Because we had our budget, and then we had what we think it's going to be.
Right. No, I did not. And that
Okay.
3-digit word that I won't say out loud, OOH, placements, that I projected to be X amount over budget.
Right.
At the moment,
Fine wood.
they won't be.
Okay.
But at the moment, we still have 3.5 months left in this year. But the costs of adding those now, one of the two positions, the two of them together would be $7,036 extra in 2016.
Okay, so, Commissioner Moe, I don't think has question really answered. So if, Jeff and Josh, did you respond to that?
Yeah, I mean, you're
Is
bringing
that
this
good?
forward, and Jeff is too, obviously, so, I'm assuming that this is then a priority for you to be bringing forward early.
I'll speak to it, yeah, I clarified, we had our budget meeting yesterday, and I was uncertain at that point in time, but the 2017 requests, so items A and B, it is hard to represent one additional FTE, because we've moved a half of one out, so we want to replace that half of one, so A is a half and B is a half, so this is representative of one additional FTE.
Okay.
But we're adding a half
To
to accounting,
So it is 1.5.
So it is 1.5 extra costs.
And that is all included in the 2017
Correct.
request.
Right.
Okay.
So it was written in, yeah.
Yes.
Sorry, I'm
Okay.
right in the, I started right in the process of the 2017. Yes,
Yeah.
it was in what we submitted.
And the addition of any FTEs would of course have to be authorized by the board. Just putting it in the budget doesn't mean that it's going to happen.
Yeah.
So that's the conversation Josh and I had offline yesterday at another meeting, was to make sure that we knew we had to do this. The reason for the urgency in the 2016 is because we know we've got some staff time offs coming up, and we know that in key places, we're gonna get further behind if we don't ask for this. So really, there's two questions to be considered. One is this the right level of staffing for this department going forward in 2017? And then B, can we afford to do it now, or can we afford to delay? I don't, the cost of that, I'm gonna have to have Josh and his staff specifically speak to.
And,
And then there's another consideration too, right, Josh?
well,
We've got good candidates.
yeah, I was gonna say, the other part that came up is from the history of what I've heard, we don't always have the candidates to fill positions, but we had an interview pool that had numerous good candidates that could fill positions now. And with a maternity leave and a couple other things that are happening on the horizon, and that's one of those positions where I'm told generally we like to bring in a temporary worker or something, but in that area, it's one of those areas that you're bringing a temporary worker to train them, and by the time they're trained, it's a wash on whether we're getting anything out of them. So I guess what convinced me really was just that, and really looking at that, and Yafa can kind of give us the number, but with the estate recoveries and the amount of overtime we're working and the minimal of 50% reimbursement for the caseworkers and eligibility workers, can we afford not to do it and push our cases back?
And to generally give a better answer to Commissioner Mo's question is, in reviewing the proposed budget for 2017 with Yafa and with Brady and with Josh, and sitting down and looking at it, the change in revenues and the change in staffing ended up not being the thing that's causing an anticipated increase in the budget for Health and Human Services in 2017. The driving force in the change in 2017 is the wage increases, the benefits increases, and budgeting a little more of a contingency for out-of-home placements, so that if we have something, we can plan more reasonably for the 5-year average of what the placements are. So the budget reflects the fact that we believe that there's going to be revenue to offset a good portion of this additional staff, that the additional staff is not what's causing the additional request of about $500,000 of additional revenue, or additional expense in Health and Human Services came from the increases in wages and benefits and the out-of-home placement number, correct? Because everything else, the services, the reimbursement, the revenues, all kind of leveled out to not have a change over 2016 anticipated numbers.
Commissioner Dicker, you had your hand up, did you get it?
Thank you, Jim.
Yes. Motion to approve all items under 7 for action, additional 1 FTE, additional 5 FTE, and additional posting of staff to replace the staff that was just terminated.
25. 1.5. Which step?
So A, B, and C.
Do I hear a second?
Second.
Jerry second? Okay. And discussion. Commissioner Moore.
Thank you, Madam Chair. And I guess at risk of being the bad guy here, we're looking at a significantly large increase in the levy overall. And when we approve something before the budget process, then it changes the status of those requests in regards to the rest of the budget. It no longer becomes something that we're weighing in the context of the other challenges we have before us, but it becomes then part of our established budget going forward. Because of the dramatic needs we have across the board, I'm not comfortable in approving it before, and I apologize for that.
Commissioner Sturgeon. Jerry, do you have the resolution that you folks put together?
Yes, but I don't know if you got the copy of this or not.
Well, essentially, this just speaks to what they presented, and we supported unanimously the recommendation of hiring the full-time equivalency. And I have to go, I don't know
I
if absentee
understand.
ballots
Sorry, you got to-
count, but I have an absentee ballot here.
No, that's okay. I'm glad you got to read the, or at least make the statement about the resolution.
Yeah.
Does that satisfy that piece of your report? Good.
I think it does, yeah.
Okay.
Yeah.
Great. Thank you.
Thank you.
Other, Commissioner Kurt?
We know that the state is gonna give us more responsibility and not any money to do it. And so over the last year, we've had to add staff and change things that have affected the budget. And right now, we're looking at an opportunity. I know that our levy is high, but we're looking at an opportunity to get ahead of this. The state is not gonna lighten up on us. And even with AMC's platform, like Josh said, we don't necessarily have the power. And so knowing that it's in the budget and being ahead of it, I'm comfortable with this, and I know it's tough.
Thank you, Commissioner.
Thank you, Madam Chair. I appreciate, the comment, Commissioner Moe, relative to decisions that we make throughout the course of the year prior to budget process. If we're gonna have integrity, we have to be accountable to. And that's a comment that's been made in our budget discussions and that I have made consistently is that first obligation is to honor those things that by motion we support. And as we go through the year, we need to understand we're accumulating those responsibilities because of actions we take. This decision, and it's why I asked the questions, evaluating it on multiple levels. Let's just say that the presentation came and the need to fill a gap because of things that are happening with our existing staff in the long term, and you alluded to it, we normally would put a temporary in to do that. But because of all the other components that inform this, recommendation that support it, it makes sense in that context. So if something makes sense because of an evaluation of all of the component parts, and we support that because it's well-reasoned, then it means with the budget process, we have to look, it's all a matter of prioritizing. We have to look at that budget and say, we made a commitment to this, now we have to rethink these other things. That's why it's important that as we go through the year and as we go through the budget process, we are evaluating based upon an assessment of all of the things that come to inform us as to decisions that not only affect, our level of service, but affect our budget. And I put all of the discussions that we've had in public health and human service in this context, and I support it on the basis of it is well-reasoned. The reality is, we're gonna have to wrestle with where, and I've said this before, where that air goes in the balloon, because if you push it here, you're gonna feel it over there. We've gotta do something, because we only have so much in the balloon.
One of the reasons, and I really appreciate everybody's comments, and it is awkward to be looking at this for this year, and then to be committing, because in a way, like you said, committing to 2017 when we haven't even reached a point at agreeing on a budget yet. But one of the reasons I support this is that overtime piece, even though it's not in the budget currently, it's money that will get paid eventually. So again, it's already spent, it's just not showing up yet. It will show up at some point, so it's just kicking it forward. And I think everybody sort of understands that idea. So I think approving this hire is just a way of alleviating not only the stress on the staff, but it's very important to alleviate the stress on the staff, but also that cost is, it's already spent. So we might as well alleviate some stress in adding this staff.
Yeah, thank you, Madam Chair. And certainly the overtime is a component of it. It's money we're spending. and there's multiple
And that's
components.
why-
That's why the discussion is helpful, because it informs that. My question to Josh would be, that after the board met last time to discuss 2017 budget, our county administrator was asked to ask departments, can you take a look at anything that you might, based on assessment of priority, make some wiggle room in? And so if we mitigate a decision to spend money here, is there something that might be able to alleviate that pressure elsewhere in the budget presented 2017?
And that's what I was really hoping for, walking through with Yafa. You know, you kind of always think in your job, like, I'm a budget person, as I told you guys, so I kind of was really excited to go through it and hope to find more places. But the place that makes human services budget interesting to me is, and as you guys know, is there are quite a few categories where I could hope for the best, and I could cut the budget back with like out-of-home placements and some of our sliding fee scales and some of these areas. The problem is I know that I don't want to cut into a fund balance that's no longer there. So where they're fluffing like desks or computers or anything, they don't have a budget for the things that, their extracurricular things, trainings, meetings, those kind of things that I would normally be like, okay, we can cut here to have a person. I could make it pretty by cutting areas, but I think that it's, if there's no fund balance and that goes to the general fund, and I know enough now to see how Yafa made her predictions in those areas, and I guess I just don't feel comfortable cutting them either. As I told Jan this morning, the only non-mandated services we have, I spent a lot of time asking questions at the district meeting, where unfortunately, like the position of that was presented to you guys today is one that's not mandated, but you see, so it's I guess where I say there are two things that are prevention that aren't mandated that I could cut those positions, and those are the places I would. But again, it's then you're trading prevention versus out-of-home placement and more cost later. So I see the difficulty. But to Commissioner Moe's thing, hopefully you'll see this from me as time goes on. Like, I really feel like this is a necessity to meet the mandates, which is why I would bring it to you. I tried to cut wants out. I can kind of talk a little freely here, but one of the things that's really, there's a definite worker shortage in social workers out there, and having Grace as a supervisor and a worker at the same time, I would love to see her have the time, and you saw that they're trying to cut back the cases anyways, but to see Grace have the time to work with her new staff and really train them up. But I know that deep down that's still a want. It's probably needed, but it's a want that I have and not a need. I think we can fulfill the mandates and everything without it, as much as Grace and I would love to have it. But I just don't see the area where Allison's at. I got to spend a day with her working with this med system, which I can confer with everyone else. If you guys ever want to work with her, it's just a piece of junk compared to what they used to have. And I see this as a need. It's not something that I feel like they can do without moving forward.
Mr. Story, did you have a... Thank you, Madam Chair. Well, I listened to the needs that you have in your office, and it takes a human toll on yourself. You are working with our neighbors. All of us have neighbors who you help in our county, and I think I'm willing to look at our budget and cut other ways rather than human ways. So I support you.
Yeah, thank you, Madam Chair. I'm just going to quickly say that when you feel pressure from the board that we need to cut, and appreciate that empathy, but having this conversation with Yafa, that when you say, can you find money? Well, then we start to, realize it's very challenging, but we start to cut back in areas and then hope for the best. And we end up sort of where we're at here with 2016, which our best guess to empathize with the need to cut. We did what we did, and we hope for the best, but it didn't turn out that way. So I appreciate an honest, response. And as I said to Yafa, I would rather, it's not an insistence, it's a refining and a proving of the numbers that are projected. And if somebody can defend those and honestly and present the position that they've taken on that, then we need to accept that. Because if we insist and push somebody in a position to fudge numbers and we end up paying, but that's not being responsible. So I appreciate that.
Josh and I spent 2.5 hours last Friday going line item by line item, looking up details. We did some adjustments on 2 expense areas and a few revenue areas, and I think the savings were $2,000. So we didn't even bother submitting it, because when we were asked for, can you make some real changes, $2,000 is not a real change. And Josh was asking some very good questions. And our biggest line item that we talk about with placements, Grace and I relooked at our estimates a month after we originally made them and said, yes, they're still fair numbers, they're not fudged. We didn't make pie in the sky huge estimates beyond what we thought would actually be happening. And I think what we've been saying since then, we did put accurate what we anticipate to happen, but you never know. Because we're talking about things happening in people's lives a year from now, 6 months from now, just don't know. But based on 5-year history, our numbers are fair for next year, and we're not going to be caught like I had anticipated that this year will be. Everything I cut, I should have doubled instead, which is why Commissioner Dukert voted against the budget last year, because she said she thought that we were cutting our budget and we were going to end up having to spend that money anyhow. Excuse me for paraphrasing you, but
Well, my only
It's
thought
true.
today is you hope in one hand and poop in the other, rub it together, what do you get? And that's what happened in 2016, and that's what's gonna happen in 2017, so I don't like poop on my hands.
Okay.
That was as clean as I can make it, because you know there's another word.
Are we ready to vote?
I don't know that we'll ever be ready.
Those, those opposed? And those in favor?
Aye.
Aye. And Carla had also indicated her support for it.
Great, thank you.
Thank you.
So, and hopefully with that, and with Josh as our new Public Health Human Services Director, we can move in the direction of the new model of prevention, which it would be really exciting to move us in that direction. And it would feel way better spending money on prevention and reaping the benefits of less cost. That would be really fun, wouldn't it? Thanks. So, committee reports. Arrowhead Economic Opportunity Agency. Mr. Gabbard.
Yeah, both my reports, there wasn't anything significant that relates to us. There's things obviously that we discussed, but I think in the interest of time that I wouldn't be advocating my responsibility of communicating by bypassing.
Okay, thank you. Arrowhead Health Alliance did not meet. Arrowhead Region, you spoke on behalf of Regional Practitioner. And Community Health Board hasn't met. And Jerry, did you want to report on
Yeah, we met
advisory?
2 weeks ago, and just to keep this short and sweet, a couple of things. HDC has indicated they're fully staffed at this point, and they've hired a new position called a peer specialist, which is sort of a person who has been involved in receiving services, now supporting others who are in the program. There's an agreement, I think it's worked out by now to have HDC licensed mental health providers signing off on case management notes or plans that are created by PHHS. I think that's it's set up by now. And along the lines of behavioral health or mental health services, Rita Plord from Sawtooth Mountain Clinic told us about their 2 staff members now who are providing behavioral health services right on site, which I think is an excellent new development, because you don't have to see people get referred and then not have the referral work out or have them move to another provider that they haven't met before. You now have a doctor saying, we'd like to bring in a consult here from a mental health person, and I can call him and he'll come right up and meet this person briefly right on site and right at the time. And I think it's really a step forward in short-term interventions and planning for mental health. Then she talked about, there was a program on WTIP on the 15th on drug use and abuse, opioid abuse in the county. The third Thursday program involving several clinic staff, and I believe Grace
Did they just have it?
was there, it was part of that. Yes.
Yeah,
Those
just-
are just,
So is Pat.
Yeah, it was awesome.
that's right, yeah, okay. Uh-huh. So, just a few highlights of, it was a long meeting we had with the community health report. We went way over time too, so, but it was good stuff.
Great, thank you. And Commissioner Storley, Healthcare Planning Committee.
Yes, we did meet, and for the first time, we've been bringing HR people together, so Josh joined us, and Jared from Grand Portage, and Bob from the hospital. So occasionally they will do that, and then they can interact among each other and compare notes. There's been a musical chair moving around in the lower level of the clinic. Care Partners have moved into the Boreal office, and Boreal has moved into higher ed. So that's been happening, and that's it.
Great, thank you. And the North Shore Collaborative did not meet, so I would entertain a motion to adjourn.
So moved.
Thank you. Thank you.
Our board meeting will start at 10:35.